I'm the CEO of Long Island Cares, the Harry Chapin Food Bank. I'm joined here today in front of the food bank by a couple of friends and staff who've been working very closely with Long Island Cares for the past 3 months on a coordinated response to the COVID-19 pandemic and the issue of food insecurity. With me is Hilton Crosby, the Executive Director of Heart of the Hamptons, Kathy Demarato, the Executive Director of Community Action South Hole Town, better known as CAST, and Mary Lou Basile, the Mobile Coordinator for Long Island Care's SOS program, which stands for Supporting Our Seniors. 3 months ago, on March 13th, Long Island Cares implemented our COVID-19 response plan. During the month of March, we looked at the various communities. We responded to thousands of inquiries on telephone, through email, about the need for emergency food. Sometime in the middle of April, we decided to begin to transition to the long-term response to COVID-19 and the long-term need for emergency food. So for the past 2 months, everything we've been doing as the regional food bank is to address the long-term needs of Long Islanders for food assistance. And our timetable takes us through December 31st of this year. You may be familiar with the relationship and the contract we have with the town of Hempstead and with Nassau County in particular to open up a series of pop-up emergency food distribution sites throughout the region. We're also working with the town of Babylon, working with the town of Islip. But more importantly, we're working with our member agencies. On March 13th, when we began to respond to the need for food as the result of the pandemic, it wasn't about just Long Island Cares responding to the needs of the community. It was about Long Island Cares working collaboratively with our 664 member agencies to provide the emergency food. If it was just us, we could not address all the needs that exist in the Long Island region. So having as our partners our 364 member agencies was critical to our ability to provide food to those in need. However, Long Island Cares also operates 5 satellite locations. In addition to our building here in Hauppauge, where we're still distributing emergency food boxes to members of the public that come here, we operate our own pantries in the village of Freeport, Lindenhurst, Huntington Station, and our newest satellite location in Hampton Bays out in the Hamptons, which opened up on March 1st. We certainly didn't know what March 13th was going to bring to us, but having the ability to open up on March 1st on the East End gave us the opportunity to provide even more support for our member agencies that were out on the Twin Forks. As of today, Long Island Cares is providing emergency food through 25 different locations. All of the locations are listed here on that poster. The ones on top are the locations that both the town of Hempstead and Nassau County are supporting with funding, and the bottom 5, those are our satellite distribution centers. In addition to our satellite distribution centers, we also operate a pet pantry in the village of Lindenhurst. That would be Baxter's Pet Pantry. And I can tell you, starting March 13th, the need for pet food for people who are self-isolated, social distancing, staying at home has become very important. So during the last 3 months, we really have been investing a lot of time and energy in wanting to know why people are coming to the pantries, why they're coming to the food bank for food assistance. And as you'll recall, in the early days of the response to COVID-19, there was a great deal of discussion about first responders, our doctors, our nurses, emergency medical technicians, and right behind that, food banks started to be looked at as essential services. So therefore, organizations like Heart of the Hamptons, CAST, Long Island Cares, we have not stopped. We have a staff of 53 people at the Regional Food Bank, and today the staff has grown to 82. We've been able to hire 30 temporary staff people to work at the various pop-up distribution centers throughout Nassau and Suffolk County. And we really are running out of space here in Hauppauge, but we're going to make do, especially with the 25 locations. So a lot of questions have been asked over the last 3 months as to what COVID-19 is meaning for the food banks, for the pantries, for the other emergency food distribution centers, and we've been able to get the data. And the data I'm going to share with you today is unduplicated data. It's culminated, it answers the question, how many new people on Long Island that due to the COVID-19 pandemic are finding themselves impacted by food insecurity? So let me share the data with you. Just at our 5 satellite locations, again, Freeport, Lindenhurst, Huntington Station, Hampton Bays, just at those locations, in the first 3 months of the COVID-19 pandemic, we assisted 18,817 people in need. That represents a 33% increase over the number of people that we served at these locations just 1 year ago. The number of people who turn to Long Island Cares for food and that have never been to a food pantry before in their life, these are the new people. That number is 48,973 Long Islanders that are struggling with food insecurity right now, that before March 13th, they had no need for emergency food. In the last 3 months, we've also delivered we've made 390 deliveries to people who are homebound and couldn't get to their local food pantry or get to Long Island Cares. So when you take those 3 figures together, it gives you a sense of what is going on in Nassau and Suffolk County related to emergency food assistance and the issue of food insecurity. And that number is 68,180 people. If we then go back and look at the 48,973, add the home deliveries of 390 to the total, we can back out an unduplicated number of 49,373 people. And what that means is that due to the COVID-19 pandemic on Long Island, we have collectively seen an increase of 72.4% in the number of people requiring the services and the support of local food pantries and the food bank. In the last 3 months, Long Island Cares is also seeing a 39% increase in our food purchasing. This is directly in response to the COVID-19 pandemic. In the last 3 months, we've purchased 3.6 million pounds of additional food to bring in to help feed the 72.4% increase. That's a 39% increase over last year during the same time period. If you take the poundage and you convert it into meals using the Feeding America metric, Long Island Cares and many of our major agencies combined in the last 3 months alone have provided 4,537,541 meals to Long Islanders in need. What we can say right now, without a doubt, with true confidence in the numbers, is that we are going to see here on Long Island, conceivably in the months to come, and maybe longer, a 20% increase in food insecurity, based upon the numbers that we've been able to pull together for the first 3 months of our response to COVID-19. So that's going to equate to about an additional 105,000 Long Islanders who are going to be using the emergency food system long term. Why? Very simple. It's anticipated by economists and experts in labor that at least 30% of the people that have lost their jobs due to COVID-19, furloughs, layoffs, terminations, about 30% of them are not going to be able to return to their jobs. The jobs will no longer be there for them. If they've worked full-time, it's conceivable their hours are going to be reduced to part-time hours. And that will create more demand on the emergency food network here on Long Island. So those are the numbers that we're looking at right now. To reiterate, a 39% increase in food distribution, a 39% increase in food purchases, a 20% long-term increase in the number of people that will be relying upon the emergency food network in the months and perhaps even year to come. I'll share one more statistic with you because it's new and it's unduplicated as well. In opening the first 11 pop-up food bank distribution centers in the town of Hempstead, we've seen 11,297 people just in the town of Hempstead alone. What we're able to take from these numbers is who are the Long Islanders impacted by food insecurity right now as a result of the COVID-19 pandemic. So what we are seeing is 53% of the people coming to us within the town of Hempstead are adults, 40% of them are children, and 7% of them are senior citizens. And for many of the seniors, they don't have an opportunity to get in a car and go to a food pantry. And therefore, having the pop-up food bank distribution centers at the senior centers in the town of Hempstead has been really welcoming for the seniors there who need this kind of support. So those are the numbers. With that, I'm going to invite Kathy up, because as you've seen in the last 3 months, with all the attention focused on food insecurity, there's a pretty big focus on the Twin Forks and the Hamptons. And we know, since this is our summer season, that the Hamptons are a unique part of our economy, a unique part of our region. The reality is that east of Riverhead, there are more than 9,000 Long Islanders struggling with food insecurity, and we have some of the most creative organizations on the East End, and I'm not just talking about Long Island Cares. So please welcome Kathy from CAST.
Good morning. Thank you for having me, Paul. As a member agency of Long Island Cares, we just want to express our heartfelt gratitude for your leadership and support. We could not do what we do out on the East End without the support of Long Island Cares and all the other generous donors and sponsors and supporters that we have. As many of you know, the first case of coronavirus was in South Hall Town, and that came to our attention on March 9th. So on March 13th, we called an emergency food security meeting with stakeholders in our community and said, how are we going to respond to this crisis? So by that next Monday, March 16th, we had put into place several programs. We expanded our food pantry, which is located in Greenport, and we created 2 satellite locations at 2 churches, one in Southold and one in Greenport. We also expanded our mobile pantry, which was a program that was new to us in January, to expand it to people not that were already on our list, but people who were homebound because of health reasons, they were vulnerable, or because they were ill and could not get out. We also created an emergency feed-a-kid program because we knew the schools were closed. So what were we going to do to serve those children who relied on free and reduced price meals? So we immediately went into action. We also decided to purchase IGA gift certificates and food cards, as well as restaurant gift cards to help to support the local restaurants in our community who we knew would be struggling. So we immediately were on the front lines seeing an unprecedented need. We've seen a 5-fold increase in our need. And you know, many people look at the North Fork and think of the beautiful beaches, the vineyards, the farms, the farm-to-table restaurants, the breweries, but they don't think about the people who make those businesses work and make the North Fork the North Fork. I say our clients are the invisible thread that keep the North Fork together. They're working in the restaurants, on the farms, in the vineyards. They're cleaning houses, they're doing the landscaping. They're vital members of our community, and they rely on the wages that they get during the season, which is really from March through November. So when this started, many of our clients who are, don't have a cushion were out of work. They're still out of work. Some are unemployed, some are underemployed. So I want to share with you some of our numbers to show the increased need. So in February, before COVID, we had 161 household distributions, and we provided 4,961 meals. In March, as you know, mid-March, our lives changed. We had 594 household distributions, 12,150 meals. In April, we had 1,156 household distributions, 19,747 meals were provided. And in May, 1,743 household distributions, 23,318 meals were provided. Our food expenses pre-COVID were about $1,200 a week. This week I spent over $10,000 providing food. So I just want to reiterate that this is not on the downslide right now. We're still seeing incredible need. We know many people are unemployed, and about close to 25% of the people we're serving now are new clients that hadn't come to us for help before. So we greatly appreciate the support of Long Island Cares, and honestly, we could not have done this without the wonderful people on the North Fork. We have about 80 new volunteers that have come to us. We immediately created an online volunteer portal for people to register as volunteers and to schedule their time. And we could not have the satellite locations and meet the expanded need without the support and the generosity of the local community. I just want you to understand that this food insecurity is a major problem right now in our community, and I don't see it going away in the short term. And we want to ensure that families and children have the important nutrition that they need, and especially for people who are recovering from COVID or are at risk, the nutrition piece is incredibly important to keep them healthy or get them back on track. So I want to thank you for having me here today, and we will continue to serve on the front lines and do the best we can to meet the need out on the North Fork.
Hello, my name is Hilton Crosby. I'm the Executive Director of Heart of the Hamptons in Southampton, New York. I want to say thank you to all of the staff and volunteers and everyone at Long Island Cares. Your support and communication within your partnership and having us as a membership agency is absolutely unprecedented. During these times, it has been daunting that the increase in need within our community to the point where it's hard to kind of understand without looking at the figures. I would also like to thank the East End community and the Long Island community as a whole for your support through volunteer, through donors, and through just general support and education to the community as to the magnitude of insecurity in our community. Heart of the Hamptons has had to adapt drastically our services because we operate out of a basement. We have had to carry food in the first number of weeks during this crisis to the top of the drive in a 2-hour period so people can come through to distribute food to them. And the first couple of weeks, we were having to reorganize, and if it wasn't for all of the volunteers and the help of the community to get the food to the top of to the customers, and then to also adapt our programming and our facility through the purchase of a conveyor belt in the basement to get these bags, to ease the labor, to make us more efficient. And the efficiency, excuse me, I'll pull this up. So basically what we would normally see in April for 2019 was 188 households where we provided the grocery or food equivalent of 4,923 meals. Whereas in 2020, we saw 837 households served and 32,810 meals worth of food distributed to those people. In May of 2019, we saw 164 households with 4,753 meals distributed, whereas May 2020, we saw 755 households with 29,596 meals. On average, Heart of the Hamptons within a year distributes the equivalent of about 65,000 meals. So in 1 month, we distributed half of that amount. And in this time, we have been creative with our community and with our partners such as Long Island Cares, Hapco Farms. We've been able to provide a 40-pound bag of food, a 20-pound box of varietal produce. The Southampton Animal Shelter has been there to provide food for animals, and we've also partnered with other organizations such as Honest Man Catering and East End Institute, and they are now providing fresh fish from the East End fishermen. So it's really a community effort, and the produce that we are providing is New York and Long Island produce for the majority. And we are also work with the schools, and when purchasing produce, when we are distributing and we kind of over order, we distribute that to the schools because that they are struggling with getting nutritious meals for the lunches for free and reduced cost families that are in that program. They have a drive-through in Southampton School District. So it's really a coordinated effort throughout the entire South Fork and on the North Fork. We work with Springs Food Pantry, we work with Montauk Food Pantry, Sag Harbor Food Pantry, Bridgehampton Food Pantry, and there's a food pantry, Living Waters in Wainscott, and there is a Blaze Church in Riverhead. We've worked with the Butterfly Effect and Open Arms Food Pantry, and we've really rallied together to make sure that we are addressing or meeting needs that arise through food insecurity on the East End. And the interesting part is that the families that we are serving on the South Fork, as Kathy demonstrated, they are the families and the people that make the East End and the South Fork so beautiful, to make it so desirable for people to come out to visit and to have homes out there. And during this time, that March, April, and May times are when people are starting to get back to work to kind of replenish their reserves for the coming season. And this year, obviously, they were unable to work. So we saw an unprecedented number of new customers and revisiting customers. And I couldn't be more proud of our team at Heart of the Hamptons and the people that we were partnered with. It really is motivating to help people and to get the job done with such an incredible team of people that care so much about the people of Long Island, and to try to address and meet the need of families who are insecure. Families are understanding what food insecurity is on a front where they're finding that their children are identifying things and saying that they shouldn't eat enough food in the home because they may run out, and then they would get food from, say, Heart of the Hamptons, and the mother and the two brothers in the back of the car saying that, oh, now we can eat as much as we want because we have food now. And that was right in our backyard in Southampton, New York. And that was a very powerful message that we got from one mother. So thank you all for all of your support and for the recognition of what we are dealing with. throughout Long Island and on the East End, and I can't thank you all enough for having us here to put that word out. Thank you very much.
As I mentioned, 7% of the people struggling with food insecurity here on Long Island are our senior citizens. On March 13th, seniors also became the focus of coping with COVID-19. Because of their health issues, because of their age, they stood a greater possibility of being hospitalized if they contracted the virus. From January through March of this year, Long Island Cares was fortunate enough to receive a small grant from the New York State Department of Health to reach out to seniors here on the island to deliver food to their homes as a result of the previous federal commodities program here on the island closing down. So we've been able to take care of our seniors from January through March. I want to thank Newsday Charities for stepping in April, for helping us continuing the program. And now Long Island Cares is going to continue the program on our own or with any additional donations we can get from corporations and the business communities. But one thing we would not do, and one thing we won't do, is turn our backs on the seniors of Long Island who are struggling through this pandemic. So whether it's state money or private money or foundation money or our own money, we're going to get this done. And right now there are 1,800 seniors who are getting home delivery of food every single month through Long Island Cares and the SOS program. And the person that's making those deliveries is Mary Lou Basile. And I'd like to close the press conference before we take questions with Mary Lou being able to share with you some of the things that she's experiencing in the community with our seniors.
Thank you, Paul. So I started in January with the SOS program, supporting our seniors, and we were working with 200-300 seniors registering every month, and then came COVID. And in March, the numbers, by the end of March, we had five more registered. And now we're up to 1,818 to be exact as of this morning. The seniors were afraid to come outside. We used to go to their parking lots and they would come to us and we had a little social moment with them. It was lovely. Now they had to stay home because of fear of the COVID, fear of socializing with their friends. They had to, they were nervous. They were afraid to drive. They'd go to the supermarket. They were listening to stories about the supermarket running out of everything. So we decided to deliver everything to their doors. And I'll tell you, it's very emotional for me because I would see their faces, ring their bells, open their door, leave the package at their door and step away. And they would say, wait, say hello to me. And I couldn't. I had to say, Long Island Cares, we can't be close. Very hard. And so the food insecurity for seniors is very great, and we've reached 1,818 seniors already. And I'm so grateful for every help that we've gotten from all the private donors, from Newsday. And, excuse me. I'd like to continue with this program. Please support us. Long Island Cares does an amazing job reaching everybody on Long Island that we can, and there's still more people to reach. So thank you, Long Island Cares, for giving me the opportunity to reach all of our seniors. Thank you.
If anybody has any questions, there is a mic in the middle of the grass there. Feel free.
Hi, Paul. Carl McGowan from Newsday.
How are you?
Good. You mentioned how much more you're spending to buy food. How are you doing with donations as part of that effort?
We've been very, very fortunate. I think our CFO will attest to the fact that Long Island Cares, in the last 9 weeks, 10 weeks, of COVID-19 has been able to raise as much money as we've raised in the last 9 months. The generosity of the corporate sector, government, certainly the town of Hempstead, Nassau County, Suffolk County, probably see now, if I'm not mistaken, about a 40% increase in the amount of food that we're purchasing in order to respond to COVID-19 and the long-term need for the emergency food. What we're still experiencing, however, is tremendous delays in the supply chain, somewhere between 4 and 5 weeks. So in the past, when we were able to place an order, we could probably guarantee that within 2 weeks the food would be here. Now we're 6 weeks out on some of our deliveries. We just looked at this yesterday. We've made deliveries on April 7th, orders on April 7th that haven't arrived here yet. But right now, between the USDA Emergency Food Program, the Nourish New York program, we're able to keep the food coming in pretty well, not as much as we need. I'm hoping that this can all iron itself out probably by mid-July, mid-August. Any other questions? Thank you so much for being here today. We certainly appreciate the support.